When I switch it on, it'll go beep as they all do.
Electrotherapy has been used in physiotherapy practice for many years.
So that's all you'll feel.
Modern physiotherapy practice needs to be evidence-based, and electrotherapy is no exception. Research into electrotherapy is ongoing, and the evidence about physiology and effects presented in this film are subject to change as the research progresses. It is important to bear in mind that of the evidence that exists currently, the quality is variable, sometimes good, sometimes not so good, and the results are at times contradictory. In tandem with research evidence, electrotherapy use requires skilled clinical decision-making as to which modality to use and when. Used in the wrong situation or using the wrong dose can be ineffective, or at worst make a patient's condition deteriorate and may even be dangerous. All electrotherapy modalities involve the introduction of some physical energy into the body. This causes physiological changes that will then have a therapeutic effect to enhance the body's natural ability to stimulate and control the healing and repair processes. Ultrasound is a form of mechanical energy known as sound energy. Sound waves are longitudinal waves that cause compression and rarefaction of particles. This molecular vibration in the tissues will result in heat generation. Continuous ultrasound will therefore have thermal effects, but when it is used on a pulse setting, the heat will tend to dissipate, and there are said to be non-thermal effects. Thermal heating raises the temperature in the following tissues: periosteum, ligament, tendon, and fascia. The non-thermal effects are acoustic streaming. This is a process of eddying of fluids near a vibrating structure such as a cell membrane. This effect is enhanced by stable cavitation, where gas bubbles are formed in the tissues being treated with ultrasound. Acoustic streaming will also occur near the surface of the gas bubbles. Therapeutically, these effects are thought to increase diffusion rates and cell membrane permeability. Ultrasound will therefore have effects at each stage of inflammation, and a consequential promotional effect on the whole healing process. Ultrasound is not of value because it changes the sequence of events, but because it has the ability to enhance the normal events and increase the efficiency of the repair phase. Ultrasound to an acute medial ligament sprain of the knee.
Good morning, Julie.
Hello.
What we're going to do today is I'm going to give you some ultrasound to the side of your knee where you injured your ligament. And what the ultrasound will do is to improve the circulation and speed up the healing process of the ligament. So, are you happy for that to take place?
Yes, it's okay.
First of all, I'm going to just test your skin to make sure you can tell the difference between hot and cold. Okay. If you can feel that with your hand for me, that's the cold one and that's the hot one.
Okay.
If you could look away now and tell me what you feel.
Hot. Cold. Hot. Cold. Hot.
That's fine, thank you very much. When I do the ultrasound, you might find that it increases some of your pain, but hopefully it won't. If it does and it starts to bother you at all, you must let me know, okay?
Yes.
The ultrasound dose is calculated to be 3 MHz, pulsed at a ratio of 1 to 4, 0.25 watts per centimetre squared for 5 minutes. 3 MHz as the lesion is superficial. 0.25 watts per centimetre squared at a pulse rate of 1 to 4 is sufficient as the lesion is acute. It is estimated that the target tissue is approximately the same size as the treatment head.
Okay. Now I'm just going to run this round this area of your knee, and you shouldn't feel anything other than the head of the ultrasound going round on your skin. Okay?
Yep.
I'm going to switch the machine on now.
Working on the principle of 1 minute of ultrasound per treatment head, the total time will be 1 times 1 times the pulse ratio 1 to 4, therefore it's 1 times 1 times 5, giving 5 minutes.
How does that feel? Does that everything feel all right?
That's fine, yeah.
Okay, that's us finished. Does your knee feel okay?
That's fine, thanks.
Okay.
Ultrasound to a chronic shoulder lesion.
Morning, Julie.
Hiya.
What we're going to do this morning is to give you some ultrasound to your shoulder, and hopefully what this will do is it will speed up the circulation to the area and help the healing process in your shoulder problem. Is that all right?
Yep.
Okay, if it's okay with you, I'm just going to take your bra strap just off your shoulder and just test your skin to make sure you can tell the difference between hot and cold. Okay, if you feel that with your hand, that's cold and that's hot. Okay, just turn your head away and tell me what you can feel. Hot or cold?
Hot. Cold. Hot.
The ultrasound dose is calculated to be 1 megahertz continuous, 0.5 watts per centimetre squared for 2 minutes. 1 megahertz as the lesion is deep.
I'm going to put some gel on your shoulder to use the ultrasound. You shouldn't feel anything when I do this. You might feel a very, very mild warmth, but it'll be nothing very much. If you do get any increase in symptoms during it, it starts to become more painful, just let me know and we'll turn the machine off. Okay?
.5 watts per centimetre squared on a continuous setting is necessary as the lesion is chronic. It is estimated that the target tissue is approximately twice the size of the treatment head. Working on the principle of 1 minute of ultrasound per treatment head, the total time will be 1 times 2 times 1, where the pulse ratio is continuous. Therefore 1 times 2 times 1 gives 2 minutes.
There we go, that's us finished. Your shoulder feel all right?
Thank you.
Okay.
The contraindications to ultrasound. You should not use ultrasound in the following situations or conditions. Over the pregnant uterus. If a patient has had cancer, deep vein thrombosis or emboli, or acute infections. If the patient is a haemophiliac. Ultrasound is also not advisable to be used in the following areas: over the eye, over the stellate ganglion, in cardiac areas in advanced heart disease, and subcutaneous bony prominences.